Welcome everyone to our next episode, Herriott Dental, and we have an expert out here on crowns and bridges, Dr. Persoon. Dr. Persoon, welcome.
Thank you for having me.
Great pleasure. So, Dr. Persoon, tell us a little bit about yourself and tell your journey in dentistry and your experience.
So, my name is Dr. Persoon. I'm a general dentist working here at the Perth office right now at Herriott Street Dental for almost over 3 years. My dental journey started in 2011, and then I worked back home for a few years and came to Canada and then went to back school again at UFT and graduated in 2023. And since then, I have been working here serving the local community in Perth and Lanark region. It's been so fun so far. Yeah.
Great. So Dr. Persoon took quite extensive training on crowns and bridges, and I'm pretty sure that a lot of your patients have many questions about crowns in particular, and what's the difference between a crown and a regular filling. So if you don't mind helping us to clarify for our patients and answer some questions, that would be much appreciated.
Yeah, definitely. And that's some confusion my patient actually they have a lot of time to understand the difference between a filling and a crown. What's the function of a filling and why do we need crowns? So filling is actually when you get a cavity in your tooth. So that's where the decayed tooth, we remove it, and then there is a hole. So that hole has to be filled up with something. That's when the cavity is filled with a filling, comes in different material. Gradually, some people, they have new cavities around an existing filling, or their initial cavity is so big that the filling itself couldn't sustain all the biting force because of just the size of it. Fillings are never as strong as our own teeth. So in those cases, we need something more stronger. And that's when other options like crowns, they come into picture, which are more sturdier, more stronger, and they increase the chances of survival of the tooth itself. When we recommend crowns to someone, it's in scenario where we feel like this option would work better and we give more functions and will also help solidify or strengthen the tooth, to put it in simple terms.
So, will I be correct if I were to say that filling is pretty much used when I need to fill the tooth with something, fill in, but the crown is like a helmet to protect the tooth? It's like a helmet, and that's much stronger. Is that correct?
Yeah, so we can understand it this way as well. If filling, since it doesn't have a good strength of its own, it is strong, but not as strong as our own tooth or like a material that we use for the crowns. So it needs some support on all sides. So say you have two walls on different sides of the tooth, we go in and put the filling inside and it is supported with your own tooth. But in other cases, if the cavity is too big or the tooth is broken to a level where there is nothing to support the filling itself, then definitely we have to look at other options. So, yeah.
Okay.
And to the helmet question, yes, that's the right analogy. Dental crown, they are also called a dental cap, just because that's your compromised tooth. It goes on the top of the tooth like a helmet and provides a lot of protective covering to the tooth.
Nice. And how long do they last? How long do crowns last?
Very good question. Yeah, I would ask the same question to my dentist if I have to get a crown done. And very valid question, actually. So I would say the longevity of the crown depends on multiple factors.
Okay.
Yeah. So the number one, the most important factor is how clean we are keeping the crown itself, right? Crown, the material that we use these days, it's pretty modern. They don't fail if done correctly. They don't break, they don't fail. What fails around is the gum or the tooth itself. So if someone has a dental crown done 5 years ago and not keeping it clean, or maybe not able to keep it clean for some reason, the bacteria sitting there will definitely cause some cavities around the crown. Because crown, it's not in isolation, it is sitting on the top of your tooth. There is your tooth around it. Or there are your gums around it, your bone around it, where you can lose the bone, lose the gums as well. And because of that, the tooth itself can become weak. So the crown is staying nicely, but the tooth is getting weaker and weaker to the point where it starts to become mobile or loose, and then we have to remove it. So that's very important to keep the crown clean. one factor that determines the longevity of the crown. Other factors are like what kind of forces the crown has on it. Has it the material that we choose sometimes has an effect, but we do take into consideration your biting force while choosing the material. Other factor, your medical history can change. Someone who is healthy right now while getting crown done, 2 years later they might develop diabetes, they might develop multiple medications, they might develop dry mouth. So all those things, reduced saliva can have more bacteria in your mouth. Less saliva means less cavity fighting power, so that can cause more cavities, more gum disease. So again, crown, they are very strong in itself.
Yeah.
But yeah, if we are able to keep our gums and tooth clean and healthy and our overall health stays same, then I'm pretty confident that the longevity be very much predictable. Still things can happen, but yeah, these are one of the most I would say factors that will decide. Yeah.
Fair. Yeah. So when you mention the crown should be properly taken care of, you mean the tooth that the crown sits on should be properly taken care of. So does it mean that I have to buy a special toothbrush or special floss or special tools?
So it is advisable to have a special tools, special toothbrush in cases where you find it hard to keep it clean because of some reason. Say if we put crown on a senior person, they have dexterity issue, so it's always good to have like an electric toothbrush rather than a manual one to like let it work around the crown. You necessarily don't have to have special tools. Simple manual brush and simple floss, if done correctly, can help you keep the crown clean. Now, I would recommend talk to your dentist or to your dental hygienist how you can floss and brush nicely around crowns. It's more the technique rather than the tools when it comes to keeping your teeth clean. Yeah.
Okay. And I believe a lot of our patients are scared of getting a crown, having that perception from back in the day when pirates had a front gold tooth crown.
Yeah.
That doesn't look good. So when you do manufacture crowns for your patients, how do you accommodate in terms of the color? Because if I am very picky about my color, what do you do in that case?
Again, the material science for crown has come a long way. They can be done as naturally. If someone is concerned about the aesthetics of the crown or cosmetic, if I had to put it this way, the science behind dental materials has evolved so much that we can try to get as possibly accurately matching aesthetics as possible. There are certain ways. So before doing a crown, I always discuss with my patient about the different materials that are available. You can get a metal crown, you can get a white crown, you can get a crown that's look more natural, you get a crown that are made in layers. So there are like a ton of options. Depending on patient's need, we discuss it before starting and doing the procedure, and then we accordingly plan for the treatment as well. We do give options to our patients where they can go to our lab. They have high-tech instruments. They can photos with specific cameras, and then we can try to match the color of your crown as close to possible to your natural teeth. And sometimes it's even hard for us to tell, okay, this is a fake tooth and that's a natural crown. So I would be like I would be very comfortable in recommending you a crown on a front tooth, because I know things have evolved so much that we can very comfortably match it to your natural teeth, so that your friends and family won't even notice that this tooth is real and the other one is fake.
Nice. Thank you. Okay, so my understanding, if we were to sum up, is the crowns are actually helping to protect the tooth. They wrap around the tooth. They extend the longevity. We can make crowns from any possible material. The procedure is straightforward, I guess. It's very similar to doing a filling, just a little bit longer.
So that's it, yeah.
Okay,
Yeah.
And we can make the color like a pirate tooth.
We can get it done, yes, yeah.
And we can make it as natural so nobody can recognize it.
Exactly, yeah.
Okay?
Yeah.
So Thank you so much for clarifying all those questions for us, Dr. Persoon, and thank you for being today with us. And I'm pretty sure those pieces of information will be very valuable to our viewers. Thank you. Take care.
Thanks for caring. I appreciate hearing me. Take care. So next time if you have any concern about the crowns, please do talk to your dentist. There are certain scenarios where you do need crowns. If you had a root canal done, talk to your dentist about getting a crown done. The longer it stays without a crown, the higher the chances of your tooth breaking down. If you're concerned with the color, shade and shape of your teeth, talk to your dentist about getting a crown done on it so that we can try and improve the aesthetics or the cosmetics of the tooth. Plus, if you see some cracks or if you see your teeth are breaking down, then it might be a time to talk to your dentist again, see if a crown can help increase the life of the tooth.